Hello, everyone. Thank you so much for joining us for Talkin Kids Health. I'm Beatriz Canals. I apologize for the delay, but we are here now on this Wednesday afternoon. And we want to let you know, not sure if you're aware of this, but November is Epilepsy Month, and it's a great time for all of us to become more familiar with this condition and to find out about the latest and most innovative techniques there are, or technology, to help children who suffer from epilepsy. The specialists here at Nicklaus Children's Hospital, the Brain Institute, offer really the latest medical and surgical intervention to help children with epilepsy seizures. In fact, the Brain Institute is ranked the top pediatric neurology and neurosurgery program in the entire Southeast U.S., so this is the right place to be. And with us now is Pat Dean. She is actually a nurse practitioner and the epilepsy program specialist. Thank you so much for joining us.
Well, thank you for having me.
So when it comes to epilepsy, for those who are watching now who perhaps don't know exactly what the condition is, what is epilepsy?
Well, epilepsy is defined by having one to two seizures within a 24-hour period. And sometimes it can just be one seizure, but there can be other factors that suggest to the physician that you will go on to have more seizures. And what a seizure is a disturbance in the electrical activity of the brain, and it causes people to have various symptoms. Sometimes they can stare off, sometimes they can shake. So different symptoms depending on where in the brain the seizure is coming from.
And when it comes to children and epilepsy, what are the signs that parents can look for? I understand that the signs can be different really depending on the age of the child, right?
Yes, it would vary according to their age. If it was an infant, the signs would be a lot more subtle. Maybe they would have little spasms or little jerks. As they get older, they might see things like staring off, just kind of a behavioral arrest where they stop doing what they're doing and start to stare. They could have motor symptoms where their body shakes. They can have like just strange behaviors where they just kind of walk around in a circle or pick at things. So I would just say for parents just to be aware of anything that they don't think looks normal in their child.
Yeah, because it's interesting when you mentioned for infants, for example, it sounds like a minor sign. So would they miss it? We don't want parents out there now perhaps panicking. So is it something that you would see happen more than once? Often?
Yes, I think the thing is that if it is a seizure or epilepsy, that it would show itself, and it wouldn't just happen once or twice, but it would continue. So they would know. Sometimes parents recognize it, and they tell their doctor, and they say it's nothing. But, my advice to parents is to, especially mothers, I don't mean to be, sexist or anything, but to go with your gut and to react to what you feel. If you think it's abnormal, it probably is.
Or those very well-connected dads, right? That are
right,
with the
right,
kids a lot.
right.
They can catch it too.
Yes,
some
great
dads
yes.
out there. Then when it comes to treatment, if you do find out that your child has epilepsy, what are the treatments available here at Nicklaus Children's Hospital?
Well, at Nicklaus Children's Hospital, we've been taking care of children with epilepsy for many, many years, and we have all the treatments that are available. Now, the gold standard for treating epilepsy, and if someone presents with a first-time seizure, a newly diagnosed seizure, the first thing the doctor is going to do is start them on a medication. And so that's the first line of treatment. But sometimes medications don't work. And
so what happens when they don't work? What are the options?
If your child fails two medications, then you have to start thinking of alternative treatments. And when I say alternative treatments, I don't mean like lavender therapy or anything like that. What I mean is that at Nicklaus Children's Hospital, we offer a variety of treatments for epilepsy. We are a full-service place when it comes to epilepsy. And sometimes there's a diet called the ketogenic diet or a modified Atkins diet, which might be the right treatment for the child. There also are, and sometimes surgery is the best option for the child, the best treatment option.
And when it comes to the technology, state-of-the-art technology here at Nicklaus Children's Hospital, which I believe would make a big difference for parents confronting this with their children, for kids who are having epilepsy seizures and to get the management, what is the technology that makes really Nicklaus Children so special?
Well, what makes Nicklaus Children so special, we are what we call a level 4 epilepsy center. That means that we are prepared to take care of the most complicated cases with the best technology that's available today. Like I said, medication, we have access to all medications. We do a number of different clinical trials for new medications that aren't yet on the market, but that we can offer to people who have failed the conventional medications. We have a dietary program where we do what we call the ketogenic diet or the modified Atkins diet. We offer treatments in what they call neuromodulation, which is a vagus nerve stimulator or a responsive neurostimulator. And then we have standard surgery, and then we do other treatments like laser ablation, where they can, if you have a small enough area, you can actually not have to open up the skull to do surgery, but kind of focus in on that area and kind of zap the area with the laser treatment. And we also have the latest thing that we have is something called focused ultrasound, which means that you're not even ablating something, you're just sending ultrasound signals into the brain, and the area that's of concern is just kind of dissolved by just using ultrasonic waves.
Oh, wonderful. And that's for the treatment. What about the diagnosis? Don't we have like a special MRI here at Nicklaus Children's Hospital?
Well, we do very, very, very complicated MRIs. We look at their motor function. We look at, with the MRI, we look at how they move, where their language is. We do a 3D rendition. And we also have an intraoperative MRI, so if a child has to have surgery, they can have the MRI, and during the surgical procedure, the neurosurgeon can actually look at the MRI before the child leaves the operating room. So if there's anything more that needs to be done, it can be done immediately.
That's wonderful. Now, one of the main reasons that we do this, Talkin Kids Health, is to bring information to parents who are confronted with this situation, these conditions, to hopefully bring them some peace of mind and knowing that there is treatment and help available for them. Like with most conditions, there are a lot of misconceptions sometimes, depending. What are some of the misconceptions out there that you'd like to mention about epilepsy?
Well, I think the first misconception is that it's no big deal, and even though there are a number of I would say at least half children outgrow their tendency to have seizures by the time they get into adulthood. For some children, it really is a catastrophic illness, and it really needs to be treated immediately and dealt with, by people who really know what they're doing. And it is a condition of the brain, but it's not a mental condition. It's actually a physical condition that needs to be treated with medication, surgery, diet, whatever it is, and that people with epilepsy are.
It's serious.
It's serious, but they're like everybody else. The kids want to be happy, kids want to have fun, and that's how kids with epilepsy are.
No, and I'm sure that we've come a long way, right, in the treatment of it. So that's good news for parents.
That is good news for parents. But they have to, if the child continues to have seizure, they have to make sure that they get the right treatment. So they have to look for people who can help them get the right treatment.
Real help. Good help. The best help possible. And anything else you'd like to add for parents who perhaps are watching and just received recently a diagnosis of epilepsy, figured out that their children have this?
Yeah, the only thing I would say is that there is help out there. There's help available, and we can give them that help that's available. And we also have at Nicklaus Children's Hospital strong connections to our community. So if there's some service that we don't provide, some social service, we can direct them to where they can find the help they need. We can help them with their school. We can help them in a lot of areas of their life, because epilepsy isn't just seizures. It's the life you live between seizures. That's the problem with chronic illness of all kinds, but especially epilepsy, that there is life between seizures. And so here at Nicklaus Children's Hospital, we try to help parents not only deal with the immediate condition, but to help them get through their life and give them the tools that they need to live this life and help their children.
Well, Pat, thank you so much for all the work that you do and for giving us so much information today on epilepsy. We really thank you. If you want more information on epilepsy or find out more about the treatments available here at Nicklaus Children's Hospital, be sure to log on to nicklauschildrens.org/brain. And of course, as always, remember that this segment. Talking Kids Health is not a substitute for medical attention or advice. If you feel that you need some questions answered, please go to your doctor. And of course, in case of an emergency, always dial 911. We want to thank you so much for joining us. And please, if you have any medical topics that you would like for us to discuss here on Talking Kids Health, we'd love to hear from you. Be sure to leave a comment below, and we will hopefully be able to cover whatever topics and bring you as much information as possible. Thanks again, Pat, for joining us on this Wednesday. Talking Kids Health, I'm Beatriz Canals. Have a wonderful day. Stay happy and healthy. Thank you.